Have you ever wondered about the different options available for treating cancer? This question has likely crossed many minds, considering the global reach of this disease. It's essential to understand that treating cancer isn't a one-size-fits-all approach. The treatment plan is as unique as the individual and depends on various factors. These can include the type and stage of cancer, as well as the overall health of the patient. From surgery to chemotherapy, radiation therapy to immunotherapy, the medical field offers a host of treatment options. Each one is designed with a specific purpose in mind and plays a unique role in the fight against cancer. It's a complex and multifaceted world, but one that's worth exploring to demystify and empower. So let's embark on this journey together. Let's dive into the world of cancer treatment and explore the different options available. The first treatment option we're exploring is surgery. Surgery plays a crucial role in the treatment of cancer. It's often the first line of attack against localized cancers, those that haven't spread to other parts of the body. The primary goal of surgical intervention is to remove as much of the tumor as possible. Surgeons meticulously operate with the aim of preserving surrounding healthy tissue, ensuring minimal impact on the body's normal functions. Now, the extent of the surgery depends on several factors, including the type, size, location, and stage of the cancer. Sometimes, complete removal of the tumor is achievable. Other times, the goal is merely to reduce the size, making other treatments like radiation or chemotherapy more effective. However, surgery isn't always an option. Some cancers may be inaccessible or too advanced for surgical intervention. Therefore, it's crucial to remember that while surgery can be effective, it's not the only treatment option available. Next up is chemotherapy. A well-known strategy in the war against cancer, chemotherapy leverages powerful drugs to wage a two-pronged attack. Firstly, it seeks to annihilate cancer cells, aiming to stop the disease in its tracks. Secondly, it aims to curb the growth of these cells, slowing the progression of the disease. How do we deliver these drugs to the battleground? There are three primary pathways. Some patients may take chemotherapy drugs orally, much like any other medication. Others might receive them intravenously, directly into the bloodstream for a rapid response. And in some cases, injections are used to target specific areas of the body. Though chemotherapy is a potent weapon, it's important to remember that it's not the only one. Cancer is a complex enemy, and it often requires a multifaceted approach to defeat it. Chemotherapy is a powerful tool in the fight against cancer, but it's not the only one. Another important player in cancer treatment is radiation therapy. This approach harnesses the power of high-energy radiation, using it as a tool to kill cancer cells or shrink tumors. The radiation damages the DNA of cancer cells, inhibiting their ability to grow and divide, ultimately leading to their demise. Radiation therapy can be delivered in two primary ways. The first method is known as external beam radiation. In this process, a machine directs radiation at the cancer from outside the body. The second method, called brachytherapy, involves placing a radiation source inside the body, near the cancer cells. Each method has its benefits and is chosen based on the type and location of the cancer, as well as the patient's overall health. It's worth noting that radiation therapy is not a solitary player. It can often be combined with other treatments like surgery or chemotherapy to enhance its effectiveness. Now, let's shift our focus to some newer forms of treatment: immunotherapy and targeted therapy. Immunotherapy, as the name suggests, involves stimulating the body's immune system to wage war on cancer cells. Our immune system is naturally designed to protect us from diseases, but cancer cells, being crafty, often find ways to hide from or disable our immune defenses. This is where immunotherapy steps in, acting like a personal trainer for our immune system, strengthening it, and teaching it how to recognize and destroy these rogue cells. Different types of immunotherapies exist, each with its unique approach. For instance, immune checkpoint inhibitors work by cutting the brakes off immune cells, allowing them to attack cancer cells more effectively. Then there's CAR T-cell therapy, a cutting-edge treatment where a patient's own immune cells are genetically engineered to seek out and destroy their cancer. But what if we could be more specific in our attack, targeting only cancer cells and leaving healthy cells alone? This is where targeted therapy comes into play. Targeted therapies are like the snipers of cancer treatment. They aim for specific molecules involved in the growth and progression of cancer, disrupting their function. By focusing on these specific targets, these therapies can block the growth, division, or spread of cancer cells while minimizing damage to healthy cells. For example, some targeted therapies block the signals that tell cancer cells to grow and divide. Others interfere with the process of forming new blood vessels, which tumors need to grow. There are even targeted therapies that trigger the death of cancer cells, a process known as apoptosis. The beauty of these treatments is that they can often be used in combination with traditional treatments like surgery, chemotherapy, or radiation, providing a more comprehensive approach to tackling cancer. These innovative therapies are changing the landscape of cancer treatment. With the rapid pace of scientific discovery and technological innovation, the future of cancer treatment is brighter than ever. Immunotherapy and targeted therapy are not just new tools in our arsenal against cancer. They represent a paradigm shift in how we view and treat this complex disease. Remember, the goal is not just to treat cancer, but to do so in a way that preserves the quality of life for those affected. And these treatments are a significant step in that direction. Two more treatment options to consider are hormone therapy and stem cell transplantation. Let's first delve into hormone therapy. This method is particularly effective for cancers that are sensitive to hormones, such as certain types of breast and prostate cancers. Hormones can sometimes act as a fuel, accelerating the growth of these cancers. Hormone therapy aims to cut off this fuel supply, either by blocking the body's ability to produce certain hormones or by disrupting how they work. This can slow down or even halt the growth of the cancer cells. Now, you might be wondering, how is this achieved? Well, there are a few different approaches. Some treatments prevent the body from producing certain hormones. Others change the way hormones behave in the body, or they might involve taking drugs that counteract the effects of the hormones. The specific method used often depends on the type and stage of the cancer, as well as the overall health of the patient. Now let's move on to stem cell transplantation, also known as bone marrow transplantation. This treatment is commonly used to combat certain blood cancers, such as leukemia and lymphoma. In essence, stem cell transplantation is like hitting the reset button on your immune system. Blood-forming stem cells are the building blocks of your blood and immune system. Certain cancer treatments can damage these cells, making it difficult for your body to produce the healthy blood cells it needs to function. In a stem cell transplant, doctors first destroy the patient's diseased bone marrow using high-dose chemotherapy or radiation. Then, they infuse healthy stem cells into the patient's bloodstream. These new cells migrate to the bone marrow, where they begin to produce new, healthy blood cells. It's important to note that both hormone therapy and stem cell transplantation, like all cancer treatments, can have side effects and may not be suitable for everyone. But for those who are good candidates, these treatments can be lifesavers. These treatments offer hope for patients with specific types of cancer. Lastly, for patients with advanced or terminal cancer, palliative care is a vital part of treatment. This form of care takes a holistic approach, focusing not just on the physical aspect of the disease, but also the emotional and spiritual needs of the patient. It's about creating a supportive environment where patients can live as fully and comfortably as possible. Palliative care professionals come from various disciplines, including doctors, nurses, social workers, and spiritual advisors, all working together to manage symptoms and side effects. They address issues like pain, fatigue, loss of appetite, difficulty sleeping, and emotional concerns like stress and anxiety. They may also provide spiritual guidance, helping patients find peace amidst their journey. This approach recognizes that each patient is unique, and so are their needs and preferences. It's about optimizing quality of life, making every moment count. While palliative care may not cure cancer, it can significantly improve a patient's quality of life. In conclusion, treating cancer is multifaceted and requires a personalized approach. We've covered a broad range of treatments from surgery to chemotherapy, each with their unique focus and application. We've explored radiation therapy and its role in targeting cancer cells directly, and delved into the world of immunotherapy and targeted therapy designed to empower our own bodies to combat the disease. We also touched upon hormone therapy and stem cell transplantation, treatments that prove essential for certain types of cancer. Lastly, we discussed palliative care, a crucial part of any cancer journey, focusing on improving the quality of life for patients. Each of these treatments is a testament to the advancements in medicine and our continuous fight against cancer. But as we march forward, let's not forget the importance of early detection and prevention. Remember, early detection and prevention are key. Stay healthy and vigilant in your fight against cancer.